And we are live now. Hi, welcome to our webinar. We're back with our free live webinars. This is exciting. And today we have the Vet Insider with Dr. Stephanie Lamb, and we are going to take a deep dive into the veterinary exam. So this will be exciting. Let's find out what goes into bringing your bird into the vet. So why don't we give people just a couple seconds here, a little bit of time to log in and join us. And Dr. Lamb, hope you had we had a little bit of a break for our webinars. Hope you had some rest time, because I know you're always busy. So appreciate you taking the time once again to join us with your insight on an important topic. So,
happy to join you guys today.
And we have Arroyo with us again in the background.
Hanging out with us in the background there.
Nice. And as that's funny. Arroyo is like, now he's looking right at the camera. He's like, he's like, hey, I'm right here. So hey, we were just talking about this before we kickstarted the webinar. Just the backstory is kind of fascinating. If you don't mind, how you found how you got Arroyo, just real quick, because I just find this, like, what are the chances of this happening?
So, and I'll sort of tell you the funny version too. I gave you the brief version before, but so we lived in California. He's now 7. Yeah, he just turned 7 in March. And so we were living in California 7 years ago, me and my husband. And my husband was driving home from somewhere that he had been. And he was actually on the phone with me at the time. And he was driving and he saw something in the road and thought it was like a piece of trash or something, didn't know what it was. So he sort of angled his car so he wouldn't like hit whatever the thing was that was in the road. But right when he got up to the thing in the road, he realized that it was a bird in the road. And it was too late for him to like swerve out of the way or anything. So he just went over the bird. And again, he was on the phone with me at the time. And so he started screaming and was like, oh my gosh, I hit a bird, because he heard it like clunk underneath the side of his car. And he looked in the rearview mirror and saw it like sort of thrown back behind him. And he said he just was screaming that he hit a bird. And I was like, okay, well, go turn around and see what happened. And he was just in such shock. Like, it took him a moment. And I had to tell him again, like, just turn around and go see what happened. I was like, and it's hurt, pick it up and bring it home. So he turned around and saw the bird in like the gutter of the car lanes. And he pulled the car over. And when he pulled the car over, some ladies had seen, who were like outside of their house, had seen the accident happen. So they had run into their house and they had grabbed a towel and were coming back outside and were approaching the bird in the gutter with a towel to like pick him up. And my husband pulled over and jumps out of the car and says to them, I hit that bird. And they were like, we saw, we're going to take it to a vet. And my husband forgot in that moment in time that I was a vet. And as soon as they said, we're going to take it to a vet, he stopped and he looked at them and he said, my wife is a vet. My wife is a bird vet. And they would crossed themselves and they handed him the towel. And then he picked Arroyo up. He wasn't Arroyo at that time. He was just a little bird. He picked him up and put him in the car and brought him home. And then he just jumped out of the car when he got home because he was just so flustered and scared. So I went into the car and I picked Arroyo up. And initially my husband said, oh my God, he's a little old man. I hit a little old man. I can't believe I hit this little old man bird. And when I went in the car and looked at him, I was like, he's not a little old man. He's a little baby. He's just a juvenile. So we got him out and looked him all over. And thankfully, he wasn't actually injured, but he was really thin and he was dehydrated. And we live in the part of California where they have the wild flocks of Amazons. So presumably he had just fledged and probably gotten separated and didn't know what he was doing and made his way into the street. And so, we just started feeding him and here he is today, Arroyo. So that's Arroyo's story. He's from the wild flocks in California. And I think he was happy to start being fed, because once we started feeding, he was like, oh yeah, this is great, thank you, I will continue to eat.
Oh my gosh. I mean, what are the chances? Like a bird
Yeah.
vet, that's just that was meant to be. I'm sorry, that's just too coincidental. Like,
Yeah.
oh wow, who knew Arroyo had such an interesting backstory? That's like, it's fascinating.
Yeah.
So if you're just joining us, you're at the Vet Insider webinar with Dr. Stephanie Lamb. She's going to give us a look at what goes into the routine bird exam. And if you have a question towards the end, we'll try to get to those. But please remember, if you have a question, to use the Q&A button so we can capture the question. Do not use chat button, use Q&A button. And I think we'll get started here.
All
so
right.
let's see what goes into the routine pet exam.
Sure, exactly. I'm happy to tell you. And so we'll start from the beginning, and since it's the routine exam, I really wanted to go over, just sort of our wellnesses and what to expect during wellness visits. Certainly there's a lot of different things that can happen during illness visits, because birds can present being ill for a variety of different reasons. And so there are many, many different things that we might need to do during an illness visit. But to sort of start off with the basics of what happens when a bird comes in and we're doing a wellness visit with them and evaluating them to make sure that they are in fact healthy, and that there's nothing that we have to be concerned about. So, first thing first, when a bird comes into the hospital, the most important things are that we get an appropriate history from an owner, and that we also get our physical examination done. History is really, really important. And so we're asking owners lots of detailed questions to find out all about the bird and all about its lifestyle at home. So, we're not only wanting to know the species and the age, and if it's a male or female, we're wanting to know, what is its cage like? What's the size of the cage? What's the cage material made out of? What's the diet? How is the diet offered? How much of the diet is offered on a daily basis? How often do you clean the food bowls and change the food bowls out? Same thing with water bowls as well. How often do those water dishes get changed? We're asking history questions regarding like the furniture in the cage. We're finding out, what sort of perches they have, what sort of toys they have. And when we're asking about the perches, sometimes people will be like, well, they've got like 3 different perches. And they don't really tell us much more than that. We're like, well, what kind of perches? We want to know, the shape. We want to know the texture. We want to know, are they wooden dowels, or are they made out of natural wood, or are they made out of rope? And sometimes I think when we're asking all these really detailed questions, I think sometimes people are a little bit like, why are they asking so many questions? But asking a lot of questions, your veterinarian asking a lot of questions is a really good thing to do. And you want your veterinarian to ask you a lot of questions, because it helps them to get an idea of how everything's going at home and if the setup is right. Because, our birds they're wild animals, and we're bringing them into our homes. And so living with a bird, you have to make sure that you're getting the husbandry correct, so that they're getting everything that they need so that they can be healthy. Because having appropriate husbandry goes so far to allowing your bird to be not only healthy, but also happy too. And so making sure that they have the right kind of perches or appropriate toys, appropriate cage, all that stuff is really, really important. So we have to know that information. So if anybody's a little annoyed by their veterinarian asking a million questions, it's just part of what needs to be done so that we can direct people most appropriately. And it's interesting because a lot of times in many hospitals, nurses or technicians, they're the same thing, will go in and ask the questions first. So they'll go in and they'll get a history of all the different questions that we want asked. And then the veterinarian goes in, and many times the veterinarian repeats a lot of those questions. And sometimes I think that annoys owners just a teeny tiny bit. And the only reason we do that is because you would be surprised how many times answers change. Where people will tell a technician or a receptionist one thing and then tell the doctor a completely different thing. And I think most of the time it's a very innocent mistake. It's just that when you get asked a question a second time later on, you may have realize, oh, I forgot to tell them such and such thing. So then when we ask you again, you're prompted to go, oh yeah, I told the technician this, but I also forgot that I do this as well, you know? So the amount of questions are not meant to annoy anybody. The amount of questions are really meant to make sure we have all the detailed information that we need, because you know, a lot of times you're coming to the veterinary hospital to have your bird seen. We're not going to see you. Now, granted, many people do house calls, but the majority of the time people are bringing the bird into the hospital. And so since we can't go to your house like 90% of the time to see what your house is like and see what the setup is like, that's why we got to ask those bazillion questions. So definitely expect during your routine exam to get asked a lot of questions. Then now onto the examination itself. We did do a webinar a little while ago, several months ago, regarding examinations on birds, what people can do at home and what to look for. And I think referencing back to that webinar would be really great for owners, because what I presented during that webinar is repeated by what we are actually doing in the exam room ourselves with the patients. And just to sort of briefly go over that, when we are examining our patients, a lot of times the first thing we'll do is we're just watching them from afar initially, is most common. That initially we don't pick them up. Initially, like, you know, the bird may still be in the cage or sitting out of the cage on a perch on the exam table or sitting with the owner. And although I may be talking to the owner and asking the owner a lot of questions, the other thing that I'm doing is I'm observing that bird and seeing what that bird is actually doing. Because there's a lot of information that I can get from a bird just sitting there watching me that could potentially be very helpful. I am looking at how they're breathing. I am looking at how they're standing. I'm looking to see if they're shifting their weight in any weird ways or drooping a wing in an odd fashion. I'm also reading the bird's behaviors too, to see, is it nervous? Is it excited to be here? Does it seem like it wants to step up? Does it seem like it wants to get away? You know, reading those cues that the bird is giving me is really important before I do anything, so that I can make sure that I'm being as low stress as possible for the bird and being as safe as possible for the bird, and frankly for myself too, because birds can bite. Any animal can bite, but you know, we need to know how to read the animal really well to be able to figure out how to pick them up and safely get them into our hands to be able to do an appropriate examination that's the lowest stress way possible for the individual, because it does honestly differ from one individual to the next as to what their stress level is and what they will tolerate. So before I pick them up, I'm trying to read them to see, what do I think that is going to be the best for this bird. Now, when I pick that bird up and I get the bird into my hands, I'm usually starting from the top and working down. That's what a lot of people do. It's not wrong if a veterinarian starts in any other location. In veterinary school, we're sort of taught that you should, whatever you do with your examination, just try to make it be the same thing each time you do it, so that you get into a routine and you make sure you're not missing anything. So for ease, a lot of people will start from the head and work their way down. So we're looking at the eyes, we're looking at the nostrils, the ears, we're looking in the mouth, we're looking at the beak, the conformation of the beak, we're feeling along the head to assess for symmetry of muscle mass and bone mass. We're also touching different parts of the head to see their nerve reflexes. So I'm touching like different parts around the eyes, near the beak, to see how are they actually responding to me, because that tells me something about their nervous system and how the nervous system is functioning. When I'm looking in the mouth, I'm often looking at the very roof of the mouth. At the roof of the mouth of a bird, there's a little slit called the choanae. And that choanae connects the oral cavity to the sinuses. There's lots of sinuses around the head in birds. And so I'm looking at that choanal slit to see, is there any mucus? Is there any like discharge? Is there any evidence of any sort of drainage down from the sinuses into the oral cavity? And there's these little projections called papillae. They're like these little projections on either side of the slit that help to sort of filter stuff out and make sure things aren't going up into those sinuses. But those are really important to look at, because if a bird has vitamin A deficiencies, or if a bird has respiratory infections or has had chronic respiratory infections, you can have changes occur to those choanal papillae. So we're often really getting a good look at the mouth to assess those things and make sure that they look good. As we progress down, we then feel the crop on the bird to see if the crop feels irregular, if it feels like there's any food in it, any gas, anything out of the ordinary. Further down from there, then we'll assess the keel, and the keel and the muscle mass over the keel is really important. The keel bone is the bone that's sort of like the breastplate on the bird, which is a little different compared to mammals. Mammals, we just have sort of the ribs coming across. But birds, there's the ribs that are kind of sort of to the sides, and then there's a big breastplate muscle right in the center. And the muscle mass, the pectoral muscle mass that covers that area is actually what's used to power flight. So the flight muscles that are really important to, you know, allow a bird to fly, that's where the muscle mass actually lies. And so we're feeling that muscle mass because they should have a pretty robust breast muscle or pectoral muscle mass. If they do not, then that can be an indication that that bird is underweight or ill for some reason. Now, sometimes as birds age, particularly I feel like I see it most in African grays, more so or earlier than some other birds. But as birds age, if they haven't been flying, if they've been, you know, clipped, or they're just a bird that just doesn't like to fly, that pectoral muscle mass will atrophy some. And it's just like us, you know, if you don't use it, you lose it. So that muscle over time can become a little flabby for older birds. So it's just that it's reduced. And I feel like I see it most commonly if an African gray hasn't been flying. I'm usually starting to see that like right around when they hit 20 years of age, they start to have a little bit of reduction in that muscle mass. Now, if they're flying intermittently, then they can still work enough to keep the muscle mass up. But if you have a bird that's really just always been a perch potato, eventually that muscle mass is going to go down. So it's not always an indication of something really severe. It could be that this is just an older bird who just doesn't work out. But if it's in a younger bird, then that can be a problem. You know, that can tell me, hey, there's something wrong with this bird. I need to look deeper. As we progress further down from the pectoral muscle mass, then I'm feeling right over the abdomen area. And in a bird, their abdomen is a very, like it's kind of like a concave shape to it. So like I'll move my hand down off the keel, and then it should kind of go down into the abdomen and get this like little concave sort of curve. And the skin over that area is really like tight, almost like on the head of a drum. And so I'm feeling that area to feel, does it feel like there's anything weird in this bird's abdomen, or does the abdomen feel okay? I really should have a hard time feeling most organs. If I can feel something, especially in the tiny birds, that is abnormal. Sometimes your larger species, like your cockatoos, I would say most of your cockatoos, and maybe the macaws, sometimes you can feel like the edge of the stomach a little bit. So you might feel something like that, and you might hear your vet saying, oh, I can feel the edge of the stomach. If they do, great. That's typically okay. But if we feel things more than what we should, and that abdomen doesn't feel really concave, if it feels like just flat, not concave, or it feels distended in some way, that's abnormal. Something's big in that abdomen, and we got to investigate further. Next thing that the veterinarian is often looking at is the cloaca, because you just kind of move down along the bird. And right after the feeling the abdomen, the cloaca is right there. And so looking at the cloaca is important because you have all the excretory products of the bird come out from there. So excretory products from the kidneys, that's the urates, so the white part of the dropping that gets passed out in the droppings. That comes from the kidneys, so we're looking at that if there's any of that around the cloaca. The rectum, you know, dumps into the cloaca area as well, so from the GI tract, and then the sexual organs, so you know, your oviduct or the vas deferens, and products from those areas will dump into the cloaca. So we're looking at the cloaca, we're assessing the tone of the cloaca. If you have a bird who has been laying a lot of eggs, then that tone to the cloaca can be kind of loose. Or if they haven't laid yet and they're getting ready to lay, it'll be a little bit loose. So sometimes I can look at the cloaca and be like, ooh, this bird is feeling hormonal right now, and maybe laying sometime in the near future. After that, go into the tail, just feeling the base of the tail, and often lifting the tail up to look at the preen gland on the underside of the tail. Now, the preen gland, that's the little gland where they go to get oils from and spread the oils across their feathers and keep their feathers in good health. There are actually some species of parrots that don't have a preen gland. And so the two big ones to know about that don't have a preen gland, there's the hyacinth macaw. They don't have a preen gland. And then Amazons, so a big group of Amazon parrots like Arroyo, he does not have a preen gland. So, I know I don't need to look at a preen gland on Arroyo because I know he doesn't have one, but other species I'm going to be assessing that preen gland, because sometimes they'll get like impactions of the preen gland. Sometimes we do see cancers of the preen gland as well. So it's a really important area to be assessing. Then that's when I personally end up going to the wings and the legs as my next thing. So I go from the head all the way down to the tail and then out on the sides. And I'm feeling along the length of the wing, and I'm feeling each individual bone. And a lot of times I'm also doing like a little rotation at the joints too, like at the shoulder joint, just rotating a little bit and extending out like the elbow joint or the wrist joint too. And I'll even oftentimes extend the wing fully if the bird will let me. Sometimes the birds get a little annoyed, like feeling up on the wing area and by the leg. It's kind of their like slightly ticklish area. So they're not always super excited about that. So don't be surprised when your veterinarian's doing an exam if when they go to touch the wing or the leg, when the bird was sitting there being okay for the full exam, if they get a little antsy, that's normal. So it's we have to be careful. We're very gentle as we feel along things, but it's not abnormal for them to get a little like fidgety during that time. But we're feeling along the length of the wing, along the length of the leg, feeling the individual bones, assessing the joints. When it comes to the feet, we're assessing the grasp. When it comes to the wing, we're assessing there's a little web of tissue between the shoulder and the wrist called the patagia, and we're assessing that little web of tissue right there as well. And then listening to their heart and listening to their lungs. So we get our stethoscope on. I have my stethoscope always on me right here. And a lot of times when you're working with birds, you're using the really little teeny tiny, this is an infant stethoscope. So this is meant for very tiny baby humans, but they don't make them smaller than this that I'm aware of anyway. And so this is what we're often using for our parrots, and we're listening to their heart and assessing the heart rate, the rhythm. We're listening for murmurs. And then for the lungs, we're listening for airflow through those lungs. We're just trying to see if there's any like popping sort of noises or crackling sort of sounds. Listening to the air sacs can be done. You might see your veterinarian move this like stethoscope down to their abdomen, and it's because you have on birds, they have their lungs, but then they have their air sacs that branch off of their lungs, and those air sacs actually branch all the way to the back part of the abdomen. So you might see your veterinarian put their stethoscope like on the bird's abdomen. No, that's not a veterinarian just being funny. They are actually listening to see if they hear anything like funny down in those air sacs. Or the other thing, I don't do it a ton, but I haven't done it in certain cases where I actually put a stethoscope on top of the head because again, they have so many sinuses up in their skull that when I'm putting the stethoscope on top of the head, what I'm actually listening for is to see if I hear any sort of congested sort of sounds up in those sinus areas. So again, don't be surprised if you see your veterinarian doing that at all during that routine exam. So, that's sort of the basics of a general physical exam of what we're doing. We're really feeling them all over, looking at all those individual areas and assessing all those individual areas to get a holistic idea of what is going on with the bird and if there's anything concerning that we need to be addressing. And some people are really fast. So that's the other thing too, watching your veterinarian. They may be talking to you as they're doing some of the things, and some veterinarians will like vocalize it. Okay, I'm looking at this and this looks normal, that looks normal. And some are really quiet while they're doing their exams. And some are really fast. And it's just that, over time you hone your skill. And so you get quicker sort of along the way. So don't be surprised if it seems like it's a really fast exam. Veterinarians are feeling all over, especially those little tiny birds. You may go through it really quick because our gigantic hands compared to a little bird, we may cover a lot of ground quickly. But yeah, we're looking at all those different areas to see, is there something more that we need to do? When I'm listening to their heart, I'm assessing for that rate and rhythm, like I was saying. I'm assessing for arrhythmias, murmurs, and if I do hear something like that, then we might really need to be investigating. And we all know that birds are great at hiding signs of illness, and that's one of the sort of frustrating things about birds sometimes when it comes to their health, is they really like to act like everything's fine until they can't compensate anymore sometimes. And so they seem to decline quickly. And it's because typically something's been going on longer than what they were letting you on to know. So the physical exam is really good, because we're trying to find anything on our wellness visits before there's any sort of clinical signs. Because if we find something before there's any signs, we're ahead of the game if we find something. So if your vet finds something on the physical exam that maybe you weren't expecting, then they might be asking to do certain tests. Now, if everything on the physical exam looks okay, that's where I wanted to head down, because we're wanting to initially talk more about like our wellness visits and everything, our routine exams. Although they may look really good on their physical exam, sometimes there are still diagnostic tests that are recommended. And so I wanted to go into those because I think it's important to discuss, because it's a little different sometimes than dog and cat medicine. Dog and cat medicine, they're a little bit better about telling us sometimes when they don't feel well. But since birds can not always be so great about telling us when they feel well or when they feel ill, sometimes diagnostic tests, even when they're seemingly well on their physical exam and seemingly well at home, it's not a bad idea to sometimes consider certain diagnostic tests. And so things that your veterinarian might be talking with you about are like blood work. Blood work is something that allows us to look at how organs are functioning with a basic biochemistry panel. If you hear biochemistry panel, serum biochemistry panel, chem panel, anything like that, they're all the same thing essentially, just kind of different terms that people use. But that's allowing us to look at how is everything functioning inside. So I can do my external physical exam, look them all over and go, okay, yeah, things look good, but now I want to know how things are functioning. What's our liver function like? What's our kidney function like? What are our calcium levels like? What are our electrolytes, our proteins? And the chemistry panel answers all that information for us. And other blood thing that we will often do as a routine test is a CBC, also known as a some people will call it the oh my gosh, I'm suddenly blanking. Complete blood count. Thank you. I suddenly blanked on it for a moment. CBC stands for complete blood count. But most of the time you're going to hear it as CBC just because it's a lot quicker and easier to say. But what that is looking at is it's looking at red cells, it's looking at white cells, and it's looking at platelets. And those are all important to be assessing because our red blood cells, they're carrying oxygen around the body. So we want to make sure that our patients are not anemic or having any problems with their red cells. White blood cells are really important to assess because that's what we're looking at to kind of get an idea of if there is an inflammatory response going on in the body. One thing I will say about white cells is that sometimes when a bird is stressed or any animal is stressed, there's many species of animals that can have an increase in their white cell count, just a tiny bit, not a massive amount, but just a teeny tiny bit associated with stress. So, it can be stressful sometimes getting in the car, getting in your carrier to get in the car, coming to the vet, getting a physical exam, getting blood drawn. I mean, there's a lot of things that lead up to the time that the blood is drawn that sometimes a bird might be a little stressed about. And so that could sometimes be reflective in the CBC as a slight increase in white cells. So I bring it up because you may hear from your veterinarian that, okay, we did our wellness visit, everything was good, and let's run some blood work, and we ran a CBC and chemistry, and there's just a teeny tiny increase in the white cells, but I'm not too concerned about it. And the reason they're saying that is because the bird was most likely stressed. If everything else is okay, and there's no other indications of any other problems, then sometimes a teeny tiny increase isn't anything to worry too much about. It's going to cause us some stress, I guess, when we hear about it, but it's sometimes just a normal finding to hear that. But it's a good thing to check because, again, with birds being good at hiding signs of illness, sometimes they can have some nasty infections going on and be acting like everything's fine, and we'll get a CBC back and we'll have a really high white cell count. We're like, oh my gosh, something's going on with this bird that's causing an inflammatory response that we need to be addressing. So those are the CBC and chemistry blood work is a very common basic diagnostic that people will do. The other common basic diagnostic that people will do is a gram stain. And a gram stain is a cytology sample. So what a cytology sample is we're looking at cells. So we're collecting cells from a part of the body and we're putting them on a microscope slide. We're staining them to make certain colorations pop up that are easier to assess. And then we put it on a microscope and have a look at it and see what's on that microscope slide. And the two most common areas where we will do routine gram stains from, one is that choana. So remember when I was talking about during our physical exam, that slit at the roof of the mouth that connects to the sinuses. It's very common for a veterinarian to take a swab from that choanal slit and do a gram stain of that. The other one is either a cloacal gram stain where they swab up into the cloaca, or a fecal gram stain where they just collect feces. And so the cloacal gram stain, the fecal gram stain, they're essentially trying to collect the same data on the bird. And really what is that data? It's looking at the organisms that are present in the gastrointestinal tract is really what we're trying to assess. So the fecal gram stain or cloacal gram stain, we're looking to see what kind of bacteria are present in the GI tract. Now, you're supposed to have some bacteria in your gastrointestinal tract. So sometimes people hear the word bacteria and they can get a little bit scared, but there's many different types of bacteria out in the world. And there are many good bacteria. In fact, there are more good and benign bacteria out in the world than there are bad bacteria. So we want to have some good bacteria in the gastrointestinal tract. There's also good bacteria on the skin that help to maintain normal homeostasis, so normal functioning of the gastrointestinal tract internally or the skin health on the skin. So when we're doing the gram stain, we're actually looking at those bacteria that are there to see, does this look like a healthy population of good gut flora? Are they the good type of organisms that we want to see? And a lot of times with the gram stain, there's two different ways that cells will stain, and they'll stain either gram positive or gram negative. And we want our pet parrots to have a predominance of gram positive bacteria. So the more gram positive bacteria, the better. The more gram negative bacteria, not so good. Now, a small amount of gram negative bacteria can be okay, but more than a certain percentage are considered to be abnormal, and you don't want that at all. And that may be an indication that, hey, your gut flora is out of balance right now, which could be indicative of a primary infection going on. Or sometimes it's not that there's just a primary gastrointestinal infection. Sometimes the flora gets out of balance and becomes a secondary infection because something else is going on elsewhere in the body. If your body is really working towards dealing with say a liver problem or poor gastrointestinal health because of certain viruses that could cause damage, then you might get a secondary overgrowth of gram-negative bacteria that could be pathogenic and be a problem that need to be addressed. The other thing, other than bacteria, we're looking at yeast organisms as well, because there are sometimes a small amount of yeast organisms that live in the GI tract in low numbers that may not be causing any issues, but if they start to grow and bud and produce more, then it can be problematic and something that needs to be addressed. So that's what we're looking for in the fecal gram stains to assess the GI health. Because when we do our CBC and chemistry, that's looking at the blood work, that's looking more, again, at organ functioning, electrolytes, red and white cell counts. It doesn't really tell us about the gastrointestinal health. So the gram stains tell us specifically what's going on in the gastrointestinal tract. Or if we're doing gram stains of the choana, what's going on up in that little sinus area. We're also looking at the way that cells stain to get an idea of health as well. There's certain changes that you can see with staining of the choanal slit area that may indicate that vitamin A levels could be off or infections could be present, what have you. So those are two really basic tests that are often done. They're basic, but they're very broad, and they can be very helpful in combination with our physical exams to assess the wellness of a bird. As far as how often they need to be done, It's really, it's something that you should have a conversation with your veterinarian about, because it is going to vary from one bird to the next. You know, certain birds that are younger, or not very old, may not need to have blood work on an annual basis, whereas some elderly birds, because they're elderly, maybe it'd be better to have blood work on an annual basis to just see and make sure that we're not missing anything, or we catch something early. The gram stains, same sort of thing. Some people really like to do them on an annual basis, and it can be very helpful. But talk with your veterinarian to make a decision of whether or not it's right for your bird to do things on an annual basis, or if that individual is able to do things less frequently. So it really depends on the individual bird, what frequency they need to be done. Now, the other thing that is diagnostic that can be done is testing for infectious diseases. And I would say that's something that's often done when people first get a bird. So if you just adopted a bird from the pet store, a new baby, or if you adopted it from a rescue, it's anytime you're bringing a new bird into the home, go to your vet, get a physical examination done, make sure that bird's healthy so you have an idea of what you are getting yourself into. And if there's any issues up front, we need to know about it, up front, so we can deal with it appropriately, because, anytime a bird is coming into a new home, it's stressful. Even if it's a really good home, it's still stressful, because changes in life can be stressful. And so if there is something that a bird may be harboring but not having problems from at the moment, sometimes when they become a little stressed, they get a little immunocompromised. And if they get a little immunocompromised, then sometimes those things that they're holding on to, that they're harboring, could potentially come about and be a big issue. So it is good to get your bird checked initially, go in for your physical exam. But then your veterinarian might be talking with you about doing infectious disease screening, especially if you have other birds at home, because you want to make sure you're not bringing anything into your flock that could be devastating. There's a variety of infectious diseases out there, and for certain species, some infectious diseases are going to be more common versus other species they're not going to be so common in. So there might be a little bit of variability in the tests that a veterinarian wants to do based upon the species that they are seeing. As a generalization, most veterinarians, when they are testing birds for infectious diseases, one of the number one things that a lot of people will test for is chlamydia. Chlamydia is a bacterial organism, and there's many different types of chlamydia that are out there in the world, but the one in particular that we worry about for birds is called chlamydia psittaci. And in birds, it causes respiratory signs. This is one of the more prominent issues. It'll cause ocular discharge, nasal discharge, sneezing. They can go on to have pneumonias, air saculitis. It also can affect the liver and lead to liver problems with them. Now, that one is a really nasty bug because it's been identified in so many different species of birds. So if you're a bird, it's kind of a good thing to test for and make sure you're not carrying chlamydia, because there are carrier states. Birds can be carriers and not always show signs. And so it's something that's good to make sure you don't have a carrier. Because if you do, well, you have another bird. One, you don't want to introduce it into the flock. Two, you need to know because you need to treat it, because you don't want it to turn into a problem, because it could. Your bird may be a carrier right now, but again, if it gets immunocompromised, it could start to have problems. And three, chlamydia is a zoonotic disease. Zoonotic diseases are diseases that people can pick up from birds. And so you can get chlamydia psittaci from your pet bird. So it's a good thing to test for and just make sure you don't have it, or they don't have it, I should say, that the bird doesn't have it. When it affects people, people have respiratory signs. So whenever I've had a bird that I have tested in the hospital and it's come back positive for chlamydia, not only do I have to advise that owner of what do they need to do with the bird. That's my first thing, is I need to tell them, how do we care for this bird? We're going to need to do certain medications. We're going to have to quarantine it. This is the care that it's going to require for this length of time, because it takes a while to treat it. But then I also have to tell them, this is a zoonotic disease. This is something you could pick up from your bird. If you are having any illness signs, respiratory problems, fever, anything like that, you need to go to your doctor and you need to tell them that your bird has chlamydia. This bird also may not be good to be around children, elderly, or immunocompromised people because of the fact that, if you're around immunocompromised individuals, those immunocompromised humans may be a little bit more at risk for getting that bacterial infection. So chlamydia is a very serious bug that we don't take lightly, because not only can it be problematic for the birds, but it's also problematic for people. So that's kind of like broad across the board. Many birds will be tested for that. Now, other organisms are out there. The other things that we'll often be testing for when it comes to infectious diseases are viruses. And so there's polyoma, citizen beak and feather disease virus, also called circovirus, or also called PBFD, whichever you prefer. Those are all sort of the different ways we go about calling that particular virus. And then there's a few others. There's herpes virus. There's controversy about bornavirus, whether or not you test for it. So there are a few other viruses that are out there that birds may, their veterinarian may be saying, hey, we should test for this particular virus. But I would say polyoma, PBFD, those are sort of the more common ones that people will be, veterinarians will be recommending their bird be tested for. If the bird is coming into the home and it's never going to be interacting with any other birds outside of the home, and even if you have a flock of birds in the home and that bird is never getting exposed to any other birds, then sometimes those tests are just done once in the bird's lifetime, because essentially that bird, when it comes into the home and is tested, it's negative. Now it's quarantined from everybody else. So if you're having a closed population that no other birds are coming in, no people are coming in that have birds and potential dander on them, then they may not need to be tested again. If, however, your bird does go out into the world a lot and do a variety of things, and they may be tested more frequently. Arroyo here, I test him more frequently. And the reason I do that is because he comes with me to work. So here I am, a veterinarian. I am a potential fomite for him, meaning I could carry disease on me and accidentally give it to him. So I have to be very careful. I'm very cautious. I wash my hands quite a bit, and practice a lot of biosecurity. But I also know that he comes with me to work, so he's not in such a completely closed flock. So he does randomly get tested more than probably other birds do.
Sorry, Dr. Lamb, isn't that if you want to board your bird, you obviously some boarding facilities require that you have the vet check with infectious diseases, right?
Yeah, and so different boarding facilities will require different things. It is very good for a boarding facility to, at a minimum, require a veterinary examination. And, maybe that's sort of annoying for some people, and I apologize if it is, but the really reason behind it, the reason it's a good thing to do is because you don't want your bird going somewhere to be around other birds where they could be exposed to something nasty that bird is acting fine from, but your bird comes in and gets a virus or a bacterial infection, and then you have a sick bird at home. I mean, the last thing you want is to go on vacation and come back to a sick bird. So it is really important that when you board your bird somewhere, that facility, if they're boarding more than just your bird at one time, your bird should have an examination, and preferably it'd be great for them to be doing some sort of infectious disease testing as well, to make sure that they're not having anything staying in their facility. The reality is that we can't test for every single infectious disease out there, because hey, there's things that evolved as we have learned. I think the world has learned, that new viruses and things pop up. That happens. That's life. So we can't predict every type of infectious disease that is out there, but for the ones that we do know, and the ones that we know are more common, it is good to have your birds tested for those things. Make sure they're not carrying it. If they're going boarding somewhere, to make sure that they are going somewhere that hopefully at least has an examination done on birds beforehand, but preferably has exam and some sort of testing be done. And then just to hit a little bit on the testing for like different species. So so we kind of categorize our parrots into old world and new world species. So old world species are going to be birds in like Africa, Asia, Australia, those species. And then new world species are almost our South American species or Central American species. So there are differences in the disease susceptibility to some degree between parrots in different parts of the world. So for example, the Australian, Indonesian species, there's a lot more of a problem with them with citizen beak and feather disease virus. So some facilities may say, okay, if you're a cockatoo, a cockatiel, lorikeet, birds from old world species, they may say we need the citizen beak and feather disease virus test done on them, and maybe they may not require it as much for the new world species. On the flip side, the new world species, they're more prone to like herpes. Now, thankfully, we don't see that to the same degree that we used to when people were importing birds into the US, but that's US, other parts of the world are going to have a little bit different incidence than what we have here in the US of infectious diseases. But herpes is something that's more of a problem in our South American species. So you might encounter a facility that says, hey, this parrot, if it's a macaw or an Amazon, it needs to be tested for herpes, but they may not be testing it for the citizen beak and feather disease virus. So that's just something to be aware of, that you might encounter that. Different veterinarians may say, well, it's less common for this particular virus in this species, so we don't need to test for it. And you might find another veterinarian that says, hey, you know what, I just want to be really cautious because there's like a 1% chance that this bird could potentially get this. Let's just rule it out, make sure we don't have anything like this. And so, there's going to be a little variability because of that. There's not a hard and fast rule that you should have exactly X, Y, and Z disease tested for. And that's because there is differences in disease incidence. And over time, as we learn more, we start to become a little less broad that, okay, every bird needs this test. And we start to get a little bit more specific, saying, okay, well, it's probably okay to just test for this particular infectious disease. So that's kind of it for your basic routine exam. Is you have your examination, your history taking, and then your veterinarian may be asking to do some broad tests, your blood work, gram stains, or they may be asking to do infectious disease testing. Now, again, when it comes to a non-routine exam, not a wellness exam, you have an illness exam, there's a whole other bunch of things that could potentially be recommended. Now, we still may recommend the CBCs, the chemistries, the gram stains. We still may be recommending those infectious disease testing, but depending upon what the bird's presenting for. But there may be other things. They may be saying, hey, we want some x-rays, or we need CT scans, or what have you. And I will say, even sometimes people will do x-rays as like a broad diagnostic. So don't be surprised if your veterinarian does have that be one of their things that they like to do. And there's pros and cons to it. So it may not be encountered as commonly, but you might encounter that. And if your veterinarian, that's one of their things that they like to do for their sort of routine exams, and they can tell you, hey, I like to do it for, these particular reasons, then that's okay. So do recognize there might be a little bit of differences from one veterinarian to the next, and also different, as I kind of touched on a moment ago, different parts of the world and even different parts of the country. So I currently live in Arizona, and I have seen more cases of chlamydia in parrots here than any other state where I've lived. So I'm much more inclined to tell people that I want to test your bird for chlamydia, and have a good solid reason of why I want to test that bird for chlamydia, versus for example, when I lived in Connecticut, I had patients that I suspected could have been chlamydia cases, but I never got positives on my testing. So, there are differences in the incidence of disease in different areas. So recognize that you might have some variability there as well. And it's really because the veterinarian is trying to do what is most appropriate for that animal in the area where they live.
Wow.
So,
hey, question for you about the diagnostic tests and like the blood panels. Is there like a turnaround time that's usually like a typical turnaround time?
Great question. So for like your gram stains, a lot of people will do those in the hospital. Not everybody does, but I would say a lot of avian veterinarians will do gram stains in the hospital. If you go to a veterinarian, like say you're somewhere that's really far from an avian vet, and you go to a dog and cat vet who's comfortable with avians, but maybe doesn't do a ton of avians, they might send their samples out because they might not have the gram stain. But most of your avian veterinarians will have gram stain, that they'll just do it in the hospital. As far as, so you'll have your results like before you leave. If you are doing blood work, it depends how long it takes for various reasons for you to get results. Some, if you do in-house blood work, because a lot of hospitals do have chemistry analyzers in the hospital, then, and if the veterinarian wants to use that particular analyzer in the hospital, then you can get your results in like 30 minutes. But sometimes we'll send blood work out, and I will say I send blood work out a lot because I can get more information on the blood work I send out than what I can do on my chemistry panel in the hospital. And so if I have a patient that's healthy and doing well, then I'm not feeling rushed. I don't feel like I need to have the results in 30 minutes. Then I'll send the blood work out so I get much more information and a lot more data points to assess. And so that might take like 24 to 48 hours, I would say, is common for your CBCs and chemistries to come back. Now your infectious disease testing, that's different. Typically the infectious disease testing, because you're testing, doing very specific types of tests, it's testing for very specific organisms, those can take longer. That can be like a week or sometimes even a little more than a week for you to get those results back. Because those are the chemistries, those are something that there are veterinary laboratories all over the place that are able to run the samples and have results, next day. But when it comes to this specific infectious disease testing, those are very specific labs. Not every lab, not every veterinary lab all over the place has them. So you have to often send them to specific locations. Like, for example, I send a lot of my infectious disease testing to a laboratory that's out in Ohio. So, and I'm in Arizona. But I'm sending it to that lab because they're a trusted lab with, when I get the results, I can feel comfortable knowing that, yeah, this is a good result for me and not some potentially something that could potentially have error in it. So takes a little longer for those ones, but it takes a little longer for quality.
Quality, that's good. I mean, that's actually a pretty good turnaround time, because like in human medicine, if you go, to a lab to get your blood drawn, sometimes you wait like 10 days or so to get results back. So
yeah, I mean, there are certain very detailed tests that will take longer, but your general CBC and chemistry, 24 to 48 hours, you should have results.
Nice. And then, just see if we have time for a question or two, but
sure.
As a bird owner, is it helpful for you if you bring in some, I've heard this in the past, if you bring in the substrate from your bird's cage with the droppings so that the vet can see that?
Yes, thank you.
Or even take a picture of your cage setup so they can have a visual of what your setup is like.
Yes, thank you for actually saying that. That is something I did forget to mention. I really completely forgot to talk about the poop. I mean, I talked about the poop in the gram stain, but not more than that. Yes, it is nice to have like the paper from that day brought in, so we can just look at it and just make sure that the feces look okay, that the urate, which is that white portion of the droppings, looks okay, and just make sure that there's no concerns regarding the color consistency or anything like that of those. And then the pictures are also helpful too. I mean, it's easy to describe something and forget things, so it's nice when an owner has a picture, because then they can, just point to different things. And the other thing I will say is, if you ever have a bird doing a weird behavior, if an owner takes a video of that behavior and then comes in and has me watch that video, I love that. That is so much more helpful. I mean, descriptions are helpful, but watching a bird when it's doing some weird behavior that an owner is concerned about is so helpful, because I can assess it for myself and not assess it with the owner's eyes. Because sometimes as owners, we're scared when something is weird to us with our animal, and we may misinterpret something. And so if I'm listening to their interpretation, it may be dramatized to a degree that it doesn't need to be, or they may play it down to a degree. They may not recognize that it's a real big problem is another thing too. So videos of any weird behaviors are really helpful so that I can see it firsthand. Because a lot of times when the animals come into the hospital, they like to act like nothing's wrong. I mean, I don't know how many times I hear it that, well, now he's not doing it, you know, when they're in the exam.
Yeah, he's good. They know where they are. They're like, I gotta pretend like everything's cool.
Yeah.
That's fascinating. So I let's see, I have a question for you from Anne. And she wants to know, how will the exam change if someone brings in a budgie or other bird that they found lost outside? So let's say you find a bird. What would you be looking for when they bring it in for an exam?
Well, so if I have a bird that's come from outside, I try to get as much detail as I can from the owner, like where did they find it, when did they find it, how long have they had it for. So I'm still asking a lot of history questions, so they may not have a ton of information for me, which is okay. But I'm going to be really assessing that bird, or things I'm going to key into a little bit more, I should say. I'm still doing my regular basic examination, no matter what. But I'm going to be assessing potentially for like fractures, lacerations, so cuts on the skin, broken bones, those sort of things. I'm also wanting to assess their muscle mass to see, are they an okay weight? Because that can sometimes give me an idea of how long they've been out there for. If I've got a really skinny bird, that bird's probably been out there not doing so well for a little while, versus if the bird's a really good muscle mass and we don't have any cuts, scrapes, or problems, and this bird's doing okay. Maybe it really hasn't been out there for very long.
Yeah. Oh, that's it. And I guess if there's any kind of underlying condition, it would probably be brought forward after the stress of being outside and lost.
Yeah.
Right.
Mm-hmm.
Interesting. Okay. And then question from Jennifer: if a New World bird has papilloma, can they pass it to an Old World bird?
Oh, papilloma. Okay, so papillomas are caused by, there are little like growths that tend to be in the cloaca. That's the most common place, so you can have them in the oral cavity as well. It can be anywhere along the length of the gastrointestinal tract, but cloacal papillomas, these little lumps in the cloaca, are the most common location. That particular problem is actually caused by herpes virus. There is a papilloma virus that was isolated one time from an African gray that has papillomas, but like every other papilloma case that's out there, when they've tested it, it's been herpes that has been the virus that has caused those growths to occur. So as far as whether or not your New World bird can pass it to the Old World bird, very low incidence of something like that being a problem. We prefer to not have the New World birds around the old, like a New World bird that has papillomas. If we know they have papillomas, that bird should probably be, not around a lot of other birds. If they've been around other birds for a while, well, maybe then they're just going to hang out with those friends and that's it. But we don't want them to be, potentially spreading something to other individuals. But the incidence of actually spreading it to a Old World bird is going to be low.
Okay. And then I think this will probably be our last question for today, is from Robert. Is it normal for a conure to have a slightly wet beak when they sneeze? It only lasted one day. Is it normal to have a wet?
Well, so certainly birds can sneeze, just like us. If there's some dust in the air, you may sneeze, and it's a one-time thing and not a big deal. For it to be a wet sneeze, that's a little more abnormal, I would say. We really shouldn't have wet sneezes if it's just a mild amount of dust in the environment that got in the nostrils. Now, if it's a dusty environment, like a little more dusty, a little longer, and you got particulate matter up in there enough to stimulate the cells, the little like goblet cells that are in the mucous membranes to produce a little bit of fluid, then if you might end up having a little bit of moisture in a sneeze, that is still nothing too concerning. If it lasted one day and it was just like one little incident once and it hasn't repeated, then it very well could have been the environment was a little dusty, something got up in there enough time for it to be irritating to cause a little bit of secretions, and that's it. Then it might be okay, but I wouldn't say it's normal. I would just say it might be okay. Now, if it's repeating, then you got to get it checked out, because it could still be something in the environment that's irritating, but we need to stop whatever that thing is that's in the environment from irritating the nasal mucosa. Or we could have an infection that needs to be addressed.
Okay. All right. That is interesting. Just let everyone know that if we didn't get to your question today, we'll be working on that through the Ask Lafeber next week. We'll try to get to your questions to email you an answer. And just wanted to give you a preview for next Friday. We have on July 23rd, we have Ask the Vet with Dr. Tolley. And then after that, we have a special webinar with Dr. Susan Rose. She's going to cover avian bornovirus, common signs and treatments. So that'll be an interesting topic. I don't think we've covered that one before either. So I think that's all we have time today for. That was a fascinating look at what your vet's looking for when you bring a bird in. You just see them kind of checking, but you don't know entirely what you're looking at. So that's good insight there.
Yes, there's a lot more going on up in their brain than they're leading on to.
And I just want to know, from just my own perspective, how often is that stethoscope being like chomped on? Do you?
Oh, I've had to replace it a few times.
Because it's either going to be looked at as a toy or a threat.
Yeah, it's done chomped on. I think I only had to replace it maybe like 3 times. So I try to be as careful with it as possible, but yeah, it gets grabbed.
I guess better than your fingers, right?
Yeah.
So that was fun. Hey, I wanted to thank everybody for joining us today. It's fun to have the webinars back up. We took a couple week break here for summer, so now we're coming back most Fridays here. And I was going to announce today's winner because we have our product giveaway. Okay, I'm going to try a screen share from our sponsor of what you're actually going to be winning today. This is going to be going out to Amy. So Amy D, congratulations. You are going to win let me see, let me do my share screen here. Hopefully this goes well. We're going to send you out a bag of the tropical fruit pellets. Okay, where did it go? Let's see here. Here it is. Okay, hopefully this plays. Let's see here. Come on, there we go. That's what you're getting. That's what you're getting, Amy. Can everyone see that? That, and also a bag of your another Lafeber product bag of your bird's choice. So product of the month. Oh, so we got the Avi cakes. Sorry, the Fruit Delight Avi cakes. These are fun for birds to chew and eat and get some good nutrition at the same time. So hopefully your bird will like that too. Some cheerful music. It's like totally summertime, right? It's got like the fruit.
Nice.
There we go. So Amy, congratulations. Hopefully your bird will enjoy diving into some fun, nutritious Lafeber foods. And I guess that's all we have time for today. Dr. Lamb, once again, thank you for all the insight. And I love this new series of the Vet Insider because we really do get a nice view of what you do on a daily basis. So
great.
Thank you.
Yeah, you're welcome.
All right. On that note, everybody, I'm gonna sign us off, and all the best to you and your flock. Have a great weekend. Everyone stay safe. Bye. Until next time.